I am Scott Loughlin. This is the Data Chronicles, and here are your data points. On today's episode, we're diving into the Trump administration's Make America Healthy Again initiative. It's a sweeping plan to modernize healthcare, and it includes an important data subject: data interoperability. On the surface, data interoperability promises seamless access to medical records, personalized care, and a tech-powered health ecosystem. But beneath all of those buzzwords lies a complex web of privacy risks, regulatory gaps, and cybersecurity challenges. Interoperability is also not easy to achieve. Many have tried, and as we'll discuss, few have succeeded. There's a lot of issues to break down. So I want to explore a few important questions. What does interoperability really mean in the context of healthcare? How does the CMS interoperability framework aim to connect patients, providers, and their tech platforms? What is the ever-present need for electronic identifiers to solve the persistent issue of online identification and identity verification? How does existing legal structures like HIPAA continue to apply to this environment? And then importantly, what is the role of AI, digital identity platforms, and what is the growing concern relating to unregulated third-party access to that data? To discuss these issues, I have invited my partner, Melissa Bianchi, back to the podcast. Melissa has been a guest before, and you may remember she is a partner who focuses her practice on healthcare, privacy, and digital health. Melissa, welcome back to the podcast.
Thanks for having me.
So, Melissa, there's a lot of things happening within HHS and, largely within health tech policy in the United States. Maybe from your point of view, can you give us the context in which this new health tech initiative is being proposed and perhaps how it may differ from past policy initiatives by different administrations?
Sure. So CMS launched several weeks ago a new health tech initiative, and it's really supposed to be a new digital health technology ecosystem. And I think it really builds on a lot of steps that have been taken before the 21st Century Cures Act, and even before that, within the Department of Health and Human Services, there's the Office of the National Coordinator for Health IT, and they've been at this a long time, trying to get all of our health systems to talk to each other better, basically, to be interoperable. And what's happening now, I think, may be a bit of a great leap forward in that this administration has issued really a call for a public-private partnership and has a number of private entities on board with commitments to be interoperable across health platforms, health information platforms at a speed that's a challenge. And so I think there's a real effort here to move the ecosystem forward in a way that just gives everyone better access to health information, healthcare providers, patients. And the idea is that we're going to build on all the building blocks that have come before and really push this forward at a new speed. And I think that's part of the administration's Make America Healthy Again initiatives, part of its AI action initiatives. It really fits into this overall framework to have an interoperability framework to make the data ecosystem more fluid.
Yeah, and as you noted, right, this has been an area of focus by a number of administrations going back historically. I think the challenge in this space has been identified for a long period of time and hasn't necessarily been a partisan issue. I think everybody recognizes that there are challenges in the way that our health IT system works, in particular, having systems speak with one another, having there be a common format in the way that this data is rendered, issues surrounding making the data available in a timely way, creating, avoiding obstacles where some participants within the health data ecosystem would want to stop or prevent the data from sharing for proprietary or other reasons. Those are the kind of themes that continue to press forward the need for this type of initiative. Or are you seeing other impetuses for trying to re-engage on this important issue?
Well, I think the interest and focus has really increased over the last several years in giving patients better access to their own information. I think 10 years ago, that was present, and patients have always, under HIPAA, had access to their information. But I think there's been a big push from a number in the private sector, a number in the Department of Health and Human Services to really make sure that patients have better access and are really in the driver's seat with respect to their own information. And I think that may finally be coming to the forefront in a way that's really moving this stage of the initiative forward at potentially a much faster pace and such that, real progress could be made in that regard.
Yeah, and one of your roles, Melissa, is leading our firm's digital health team. And you probably know this dynamic better than anyone. And that is, we're seeing this continued explosion of consumer facing apps and consumer facing devices and consumer facing ways where, frankly, patients or individuals are having access or using health information at their own direction more so than the prior dynamic where largely that data would have resided only within a single set of repositories, namely doctors' offices or insurers, where they would have access to the information and patients, frankly, would be limited. I'm reminded of, I think it was maybe an old Seinfeld episode where, there was a doctor who had a patient notes and Elaine was trying to figure out, what is the doctor was writing about her, and he couldn't know, and she couldn't know, and she was always curious about what was in that particular file. That dynamic, which, dates back a long time ago, has really changed when now everybody wants their information in a way that's become accessible through more of a consumer experience. And is that playing into part of the goals for essentially unlocking this data?
Absolutely. And I think that we all have, or many of us have apps on our phone that we use to manage our health information. They could be weight loss or fitness apps. They could be apps helping you manage the care of an elderly parent. Really, any number of reasons that people rely on and use apps in their own lives for their own healthcare. And it could even be your connection in an app that's a connection into your electronic medical record, your own chart. And that's really prevalent. And I think this goal, part of the goal here is to increase the ability of all of us to access our medical records and pull those into the apps in the way that we want. Now, it's not new, right? There have been requirements around interoperability at the HHS level for a little while, right? Where you're supposed to have APIs that could be widely available using FHIR structures and really just consistent standards in which those apps could engage with medical record systems. So those have been around for a while. And I think what's happening now is an effort to really make that actionable, to bring it to the next level and really give us all the ability to pull information more easily without having so many different portals we have to go to, without having so many different passwords and credentials we have to use, but to really much more seamlessly be able to pull our own information into the apps that we want to use. And because the focus here is on a public and private partnership, we've got the private sector at the table in a really meaningful way. A number of companies that have stood up with CMS, with HHS and taken pledges to make this happen and to make this happen in a really short time frame. And we're in late 2025 and we're looking at early to mid 2026 when some of these things have to be really ready to go, ready to turn on. So there's a much faster time frame and a public-private component here that I think really has the potential to bring this to the next level in terms of moving the initiative forward. Efforts that have been in place for a long time, but been so hard to accomplish.
Yeah, and I want to get into kind of, well, what is it that is being proposed exactly? How is it they're going to accomplish this objective where many in the past have failed, including, some of those challenges that you and I face on a daily basis and managing the risks and privacy issues and cyber issues that would result here. But maybe one just larger contextual question in that we did an episode a few weeks back to go through the administration's AI action plan. That was very much of focusing on trying to increase the adoption of artificial intelligence in the ways that businesses operate, way consumers operate, to try to bring down specific types of regulatory barriers while maybe imposing some additional new ones. So I guess the key question here is, how do you see this initiative playing into that AI action plan? And do you see those two things kind of running in parallel or connected?
Well, I think they connect. I think that it's part of an overall effort by the administration to really move the AI action plan, the ability to use AI more readily as part of that MAHA effort too, right? So part of the CMS initiative is very patient focused, and in part they're focusing on a particular disease state. So they're focusing on diabetes and obesity and conversational assistants that are powered by AI so that you could, as an individual, have a conversational assistant to talk about your disease management. So I think AI is very much built into this new CMS framework. And that's part of the goal, is to interconnect it.
Yeah, I mean, I think that that's super helpful context. So let's then think about, like, what is it that we're going to do and what are we going to do differently? You mentioned several times that this is a public-private partnership almost, or a collaboration in order to move this forward. I know you and I both have slogged our way through the interoperability rules, but it is not an easy read. I don't know if it's 1,000+ pages long. So, someone out there has tried to define a set of rules that would govern this space. I don't know that that has been particularly effective in accomplishing the goals that those rules were set out. So is this partnership that's being discussed, is this a new form of regulation, which maybe would cut counter to the deregulatory environment and emphasis that we're seeing? Or are we looking for self-governance, self kind of ways of trying to be able to have mechanisms where people are monitoring their own activity, just partnership, like just public commitments? I mean, what does this actually look like?
So it's a voluntary framework, right? And 60 plus private companies have signed on in different areas. There are healthcare providers, and that means it includes, hospital systems and pharmacies. There are health plans, there are tech companies, big tech, smaller tech. And then there are consumer health apps, and again, focus more for this initial phase in the diabetes and obesity space, but that will expand over time. But they've all signed on to a pledge to this voluntary framework, and then it's not regulation. There's a tremendous amount of very technical regulation, as you described, in the interoperability rules. And there's a lot of important content there, but for most of us, what we want to know is, will we be able to access our own information? And if we're part of a company that, has an app and wants to connect into this, what does signing on to a voluntary framework look like? And what do we need to accomplish? And I think one of the key functions is going to be that there's going to be a identity management, which is very hard to crack. This idea of a master patient file where you've got the right Scott Loughlin, right? And so there's been a tremendous amount of effort in this public-private partnership to really crack that and to really move that forward so that we all have a digital identity. And I don't pretend to be able to speak to the technical criteria for that, but in essence, it's going to allow us all to have a series of credentials, in essence, that are going to give us the ability to get access to our medical records and to share them across our providers, and to not have to use a different set of credentials every time you go into your own MyChart for your different healthcare providers, right? And the goal is for there to be a more seamless sharing of patient information so that more providers have access to the information when they're treating you and that you have access to your own information. So solving for that set of credentials and this digital identity, which is not going to be done by regulation. It builds on a lot of years of regulation. But it's really, I understand, just happening by committee and a lot of people just rolling up their sleeves and working together to try to solve for this, who have made a commitment to solve for it for the middle or early 2026, which is, a nanosecond in terms of the work that has to happen to build it. So people are really at the table trying to move that piece forward. Because if you can solve for that, that is one piece of the logjam, right? Anytime you talk about interoperability, there are a lot of roadblocks, a lot of things that have to be solved. So I think one focus is really solving for how to make it easier for all of us to access information across all of these platforms.
Yeah, I mean, I think that is really important to emphasize, right? The identity management issue, the identity verification, because we're seeing that issue pop up in so many different aspects of what we do. Everything from the cybersecurity issues involving the North Korean, fraud campaigns, but we're also seeing this issue about identity management in connection with in some of the initiatives that are happening in Europe. We're seeing that issue pop up in kids' data, where you're trying to figure out whether somebody is old enough to be able to access an adult website. That thing just keeps coming back and back, and there's a variety of ways that the private sector has addressed this issue in the past. ID.me, for example, or if you go to, Clear on, going through your TSA, like there's a variety of ways that people are trying to come up with solutions to identity management, but it is a real challenge. At its bottom, right in the healthcare space, as you're noting, is if I have a health record and I have John Smith and then I have another John Smith's record, how do I know whether those are the same John Smith or different John Smiths? And then importantly, if I'm relying on John Smith's one data to make decisions relating to John Smith two, am I doing that in a way that's actually going to be at the detriment of John Smith's two life and wellness, right? That's a very real and practical problem that health IT has struggled with in trying to identify who the people are who belong to these particular records. And if we get that wrong, not only are we in a position where we can't identify John Smith 1 from John Smith 2, but we may find ourselves in a position where Jane Doe's records, or Jane Doe 1's records, have been modified because someone was treating Jane Doe 2 and thought they were treating Jane Doe 1. And now when Jane Doe 1 comes back into the operating room, all of a sudden she's given a blood transfusion, assuming that her blood type was A negative, and it turned out that it was O positive. That is the challenge that I think we're facing, which is a digital problem, it's a cooperation problem, and as you said, an identity problem.
I think that's right. And that's really what all of these tech companies are at the table working with the providers and with CMS, HHS to try to solve, to have a secure digital identity credential that's going to have a lot of technical stuff behind it to make sure that not only can you use one set of credentials, and it might be a QR code or it might be some other way that you can really access information, pull it into the apps that you want to use, that your providers can share with each other more readily, but that does so in theory in a more secure way, where we won't be as worried about the potential to steal passwords or if it works well, it could be in fact more secure. And the hope is that it could reduce ransomware events. Now, that may be unrealistic, but the goal is to really solve for that problem. Because if we can't do the identity management, the interoperability, as you're describing, it doesn't really work, and that's been a huge logjam. And there have been probably a decade of meetings within HHS, public meetings where really good people have come to the table trying to solve that master patient file issue. And this is an effort to just almost maybe not throw it out, but just change the conversation and move to a way that we can all access our information more readily without having to log in a million different places, different times, yet keep that secure identity so we don't have that very real healthcare outcomes that you're talking about.
Yeah.
So a lot of good minds at the table meeting, I expect all the time, to solve for that with some criteria that CMS has started and that all of these stakeholders are at the table trying to build. It will be voluntary. It will be for connecting in at the outset to CMS aligned frameworks, which is just basically the entities that have signed on, but healthcare providers and tech companies, payers, this group that's committed to meeting this CMS interoperability framework. And then we assume there'll be the ability for other interested stakeholders to sign on to that. But this initial group is really trying to solve for some of those logjams and clear them.
So, I think maybe within that context, Melissa, one of the stakeholders that I think has to be in the room is trying to address and manage the privacy and cybersecurity issues that are associated with this. Because and I think there may be a ton, because there's competing policy objectives that I
Yeah.
think are all coming to this moment and are being represented in those conversations, right? You mentioned the cyber issue where, the ability of expanding access to data through a single set of credentials or a single authentication process results in additional impact and exposure to the extent that those are compromised, right? In other words, if you compromise one account, well, then you can access all of the information in that account, but presumably you can't access all of the data that may reside elsewhere. But if you now have concentration of all of that data in one place, then a threat actor can be able to access it all, right? So big cyber issue there. We have kind of data minimization challenges because typically in any of these proposals, in order to verify identities, typically you're asking for more information to then be able to verify identities. Facial recognition, biometrics scannings, kind of different aspects where you can actually result in the collection of more sensitive data, which
Mhm.
compounds our cyber and privacy problems.
Yeah.
But then maybe from your perspective, all of these things are not happening in a way that it's above the law because we have in the United States a pretty robust and well-established legal system around health data, especially for at least for PHI maintained by covered entities and business associates that are going to be in play for any of these types of proposals. And then we have these interoperability rules, which I think are still regulations and still apply.
Yeah.
And then we need to manage to those, and those will have a stake. So maybe first on the HIPAA side, where do you see this initiative creating unique challenges from a HIPAA compliance perspective? And is there a path forward to overcome those challenges?
Yeah, look, anytime you bring in more data and you have more data being shared around the ecosystem, you raise privacy concerns. And if you could think back to why HIPAA was enacted in the first place, right? It was to encourage the electronic flow of information in what was a completely paper-based system, right? And so we all think of HIPAA as this set of privacy and security rules, but really the initial goal was to facilitate the electronic flow of information. And so then they added privacy and security requirements to that to make sure that as more information was flowing electronically, that we would have protections. And anytime you add more players to the system and more data flowing, you're going to have more privacy and more security issues. We have today a lot of ability to download our own medical information into apps we use. It might not be as interoperable as the hope is will be in the future, for sure. The goal is to make it much more interoperable and to make it much easier, but you can download information today. Patients have the right to receive their own information in non-secure manner if they choose to. So this just opens that up more and increases the ability to do that in the ways in which that's going to happen. But I think it's all consistent or can be done consistently with the existing framework, right? If you're sharing information from a HIPAA covered entity to a non-HIPAA covered entity and a patient's asking for that, that's something patients have the ability to do today. That was really what The last round of interoperability rules and the information blocking prohibitions were designed to make happen more readily. And so now we're moving to the next level. We've got more private partnerships. We've got more private entities that will be accessing this information. And so I think but the same principles apply. Did the patient agree to it? Did they consent? Can we help them understand what it is, what choices they're making? So if I've got a weight loss app, do I really want my whole medical record downloaded into it so that that company then has everything? That's a choice I can make. But helping me understand that choice, I think will be part of the process, making sure that the patients are in the driver's seat so they can determine what actions they want to take and what apps they want to use. But I think it can all be done in this framework. But yes, acknowledging that the more information that is in more places, potentially the more risk to that information, the more risk of it being compromised. And that's going to be a real problem, and that everyone's going to have to be eyes wide open about to make happen in the best way possible.
Yeah. And, I think on that front, that's also going to result in probably some additional policy challenges for, individual organizations. I'm thinking of, for example, the last podcast that we had maybe a couple of weeks ago now, where we were talking with one of the chief product officers of Catch, which is a consent and preference management system. And, his view was that consent online is largely just a broken process. It's very hard to figure out how is it that you are getting people in the position where they're educated enough about what decisions they are making, especially when you're trying to do that in a frictionless environment,
Right.
to maybe capture all of those consents up front, as opposed to getting those consents at the time where the information sharing decisions were being made. So a real product problem. But
Yes, for sure.
if I extend outward, right, if I say like, well, what does that mean? You and I both know, right? We've seen a lot on the state side where the states are maybe moving in an opposite direction, especially around specific types of data, where there is a concern, in particular around reproductive oriented data, about having that data become accessible to other stakeholders in the organization, in the ecosystem, especially if, all of a sudden a state that allows for abortion access, the records there are being accessible to an organization that resides in a state that is putting restrictions on abortion. And all of a sudden, those records now for state one have become accessible in state two, and maybe the theoretical concern that then the patient could be prosecuted for having sought reproductive care in a different state than where they resided. Lots of policy constraints there, which we're still sorting through. But now when we're talking about trying to have a federal overhang to try to allow for more ability of sharing data, those types of issues probably, right now we're seeing them and really focused on abortion oriented records, but that that list can probably continue as we start to see, hey, we don't actually want all of these records shared in that way that the federal government is pushing forward.
I think that's right. I mean, look, our state framework is always a challenge, and from a privacy compliance perspective, and you raise the reproductive healthcare information, but I think it's also true in other sensitive areas of information, categories of information, substance abuse, where there's a federal set of rules that applies to some substance abuse information, but state rules that apply in a lot of states. Genetic information is another place where that can be really challenging, and states have very specific and different rules about sharing genetic information. So as you move to this framework, yes, that's going to be part of the challenge. And will patients have the ability to select only some information to be downloaded to a particular app? So going to my weight loss or diet example, could I just choose some portions of my record to be downloaded there, because maybe I don't need my genetic information, but I need, or my reproductive information, but I do want my blood sugar or something like that downloaded. Will patients have the ability to be more granular? And I think back to your consent point, it's a really important one. And I think, consumer health advocates have been talking about that for a long time. People in the clinical research space have been talking about that for a long time. What is meaningful consent? And I mean, I just rush through it. Yeah. I just want to get to what I'm trying to do. And am I really reading the consents and understanding and thinking about what it is that I'm doing with respect to the movement of information? That's not going to go away. And I think that will be something that the whole ecosystem is going to continue to have to wrangle with, so that you can do a just-in-time consent like the Federal Trade Commission contemplates. You can do the kind of opt-in and consents that many of the state privacy laws require. But how meaningful is that in a world in which we're always having to consent and click through things to just get to what we want to do? That's going to be part of the challenge here. I think it's a challenge today, and I think it's just going to be even more so as we give patients more control and put them more in the driver's seat. And you gain a lot with that, and there are increased risks that people won't have understood really what it is that they've chosen. Which is not unreasonable. This is really complex stuff. And I know I'm in a hurry, and I do this for a living, and I often just click through things, right? Because I just want to get to the end goal of what I'm trying to get done.
Yeah, and we have a partner in common who is somebody who's on the exact opposite, and reads every notice of privacy practice when she enters into a physician's office, where
Yeah.
like I probably just breeze over those things because I know what they say. But it is an area where we're starting to see just this debate around, who makes these decisions? Is it really just an individual making decisions about themselves? And are they, frankly, in the position to make those decisions? Or should there be overarching rules where consumers don't really have the ability of making those decisions? Is every experience with a mobile app or a website constitute an individual contract between the operator of the app and the user, or should there be a more consistent, cohesive approach across the rules for all of them? Like, these are really important and challenging issues for which there's not necessarily one right answer, but will require this type of framework to really adapt to and almost kind of come up with strategies. And one of the important things, Melissa, that I'm sure that you would probably have seen too, is that our legal system, at least here in the United States, has a long history of self-governing frameworks coming back to bite the people who participate in those frameworks.
For sure.
There
For
are
sure.
there
Yeah.
are overriding rules. For example, whenever it is that you commit to something, especially if you commit to it publicly, and then individuals engage with you based on those commitments, and those commitments turn out to not be right, there
They
is
change, right? They
there's a bunch
change.
of problems. Yes.
Right, over time. But I think that's all exactly right. I would say, in a lot of ways, this is work that has been building for a very long time. There have been a lot of steps taken along the way to move toward a more interoperable framework. And so the question here will be, can this really speed it up? Will we have a few years of really moving things forward at a faster pace? And is that really going to be different in kind than sort of the original goals, or is it really just moving it forward? Is the goal really to go back to what, when these state health information exchanges were first set up, and this idea of a national network where if you were on vacation in a different state and you broke your leg skiing, that, you went into the hospital and that doctor would be able to pull up that you were on blood thinners or whatever else because from your home hospital. I mean, there's the goal of a lot of the interoperabilities to improve care and make that more seamless and readily available. There are risks and there are downsides, right? And this effort, I think, is also, as I said, to really put patients more in the driver's seat. But that comes with risks, right? Do we
Yeah.
all understand? Is it consented? As there's data in a lot more places, what does that there are risks to that. What does that look like? There are privacy risks. And you could have a lot of information in the hands of different companies that don't necessarily have a need for your information. And that gets to your point around data minimization, right? Organizations should be using only the information they need for the purpose for which they've collected it or for which they need it, and not trying to collect a lot more information than what is relevant to their purpose. So there are a lot of principles, a lot of privacy principles that will feed into this, and how well those are considered in this next step, I think will be an important component. But I do think it also has the ability to really move some of the interoperability goals forward in a way that people have been trying to do for a long time. We may just have another big push with a bunch of private entities at the table with some ability to work closely with government to move the standards forward in a way that meets all of those goals. And then a lot of companies who are not at the table today, who I think are going to want to think about how to be at the table. If I wasn't in the initial list of sign-ons as a company, but it's a tremendous opportunity. I'm in that patient or that consumer health app space. How do I ready myself to join on? And what do I want to join on? What are the opportunities? And as you're describing, what are the risks? Voluntary frameworks sometimes come back at you, right? And so really
100%.
thinking through all of that as a company is going to be really important.
So I think those are really good points. And maybe my last question as we wrap here, Melissa, is I think you made the point that there is, a number of companies who are already engaged, and maybe they're tracking this very closely. I suspect that there are many, many, many more companies who are not, but will be impacted about whatever is coming out of this group, whether that becomes just the new commercial norm, or that now the big actors in the space expect everyone else to participate, and they leverage their market power to force compliance. A variety of ways that this is going to just disseminate outward from this core group. If you sit outside that core group and you're being asked to say, hey, what's going on here, and what should I be thinking about going forward, maybe from your point of view, any practice points you would offer to that group about what they do to monitor what's happening, how they may want to engage or not engage, your views on that.
Sure. I think you need to start to understand it, and quickly, because this is going to move really quickly. I mean, there are very fast deadlines here. So understanding, to the extent that you can understand it, because it's a very fast evolving process, what is this secure digital identity credential going to look like? And will you technically be able to do it within your own organization? And thinking through just the details of what that would look like from a technical perspective, and making sure that you're not caught flat-footed. Thinking about the disease areas, there are a lot of companies in the diabetes and obesity state that weren't in the initial list, but may want to be. And there are a lot of other disease states you can imagine will follow, and that will be priorities for this administration. And maybe the next sort of disease state or chronic health issue that they really focus on. Are you in that space? And how can you come to the table as new conditions become part of the framework? Because they will, you have to imagine, right? So I think really understanding where the initiatives are today and what the opportunities are for your company, and whether you're technically going to be ready to meet them. I think that's a key next step.
I think that's a really good point. Well, Melissa, I really appreciate your time today and your sharing your experience and expertise with our podcast. I feel like I've learned a lot about what this initiative is looking like, at least at the very beginning of it. And I'm sure we'll have a lot to talk about in the future as this starts to take more shape and we start to understand what does this digital identity mean and what ramifications does it have for the health data ecosystem.
I think that's right. So thank you for having me, and look forward to talking more about it as it develops.
Excellent. With that, I'm Scott Loughlin. This is the Data Chronicles, and those were your data points.